Almost 15% of seniors in the District of Columbia are at risk of hunger, and the D.C. Office on Aging is doing their part to tackle this predicament. Today we will talk about the dangers that seniors face when it comes to hunger and what are some of the ways we can prevent and help our older adults from facing this terrible plight. Hi, I'm Dr. John Thompson, Executive Director of the District of Columbia Office on Aging. We have with us here COO of the National Foundation to End Senior Hunger, Matthew Levine, Paula Reichel, Regional Director of Capital Area Food Bank, and Catherine Benvey, Policy Associate from DC Hunger Solutions. Welcome, everyone.
Thank you.
So we're going to just have a conversation on what we need to do in the District of Columbia to end senior hunger. In my opening statement, I mentioned that we have 15% of district seniors who face hunger on a daily basis, and we have a number of programs where seniors can access those programs, and some of them are accessing the program. But it really concerns me when I hear a senior says to me that going to a congregate meal site, that is the only meal that I receive for that day. And so just want to ask a few questions, again, make it very conversational. What are some of the obstacles that seniors are facing across the District of Columbia when it comes to accessing fresh fruits and vegetables? I mean, what is your take on that?
Well, I'll start. Thank you, Dr. Thompson. That's a great first question. And before I get to a direct answer, one thing, yes, there are 15% of the district seniors are facing the threat of hunger, which is almost identical to the national average. A concerning number, which you and I have discussed in the past, is that between 2010 and 2012, which is the latest year that we have data for, my organization, NEFESH, the National Foundation to End Senior Hunger, we do this research every year. Between 2010 and 2012, the growth rate of seniors who are facing hunger, so the most at-risk seniors, that was 395%. So just about 400% increase in the group who's most at risk. Another statistic that I think is important to this conversation is 80% of the seniors in the district who are below 200% of poverty, the poverty line, are facing the threat of hunger. So again, it's nothing that we don't know, but the most at risk are the ones who need these wonderful services that you're providing most. They're not accessing them. So I guess that leads to the conversation, is it a communication issue? Is it a transportation issue? I've heard that from some of your wellness centers. They do great work, but some of the folks just can't get there. So I guess I'll leave it to the other two experts, but that's what we know.
I appreciate it. Ms. Reichel.
Yes, thanks, Dr. Thompson. Well, we always say senior hunger is the hidden hunger in society. Seniors, unlike many other groups, are less likely to come forward and ask for help. So we're dealing with a population that may be more reticent to receive services than perhaps other groups. So I think it takes a multifaceted approach to really communicate to them. A lot of times we've found word of mouth to be the most effective. So there's communication tools you can put in place, certainly, to communicate with them, but sometimes the best thing is to ask a neighbor or someone who's participating in a program to encourage their friends to participate. We know seniors are living in areas that don't have access to fresh fruits and vegetables. As Matthew mentioned, they may not have transportation, so it's really important to utilize those connections and connect them to services.
Thank you so much. Ms. Benvey, what is your take?
Well, I think the fundamental issue here is poverty. We need to make sure that there are policies and programs in place to combat poverty. When people don't have enough money to purchase food, the issue at hand really there is the poverty issue. So a lot of the solutions that I see to that is strengthening some of these fantastic federal and more local nutrition programs to ensure that they're accessible for people who need them, and really the benefits of them are adequate enough to support a healthy diet.
A follow-up question, what programs come to mind to you in terms of being able to bolster programs so that we can ensure that seniors have adequate food in their homes? Which programs come to mind to you?
I mean, there are a wealth of senior nutrition programs and some nutrition programs that are not limited just to seniors. The first one that comes to mind for me is the Supplemental Nutrition Assistance Program, or SNAP, also known as food stamps. Here in DC, the average benefit for a senior living alone is around $120. For many seniors, they get a smaller amount than that, but the benefit can range for a senior living alone between $15 a month to about $189 a month. So depending on the personal situation of that senior, they can that extra funds each month can really make a huge difference. Of course, there are other programs that I'm sure my fellow panelists will speak about at the Commodity Supplemental Food Program, Congregate Meals, and many others that can really make a difference for many seniors here.
Perfect. And so, Mr. Levine and Ms. Reichel, I heard you loud and clear about communications. And so I heard you say word of mouth. And at the current moment, we see that many seniors aren't even accessing services. At the District of Columbia Office on Aging, mentioned we have 15,000 seniors who are hungry. And looking at another statistic, the office only serves about 30,000 seniors on an annual basis of the nearly 104,000 seniors. So it shows you, yes, we need to do word of mouth, right? Help our seniors who need the services. But in addition, we must be able to be in front of the cameras more often, as we're doing today. We must go on the radio. We must go to those churches, synagogues, mosques, and be able to get in front of those folks who serve our senior community, and making sure that if you have a vulnerable senior in your community, let's make sure that we reach out to them. So I want to thank you so much for your insight on how do we tackle senior hunger in the district from the perspective of, especially when those seniors have food deserts. And so very, very critical. And so thank you once again. This is a very important topic, and why? For so many different reasons. And for me, is to focus on the quality aspect. And we're talking about transforming Washington, D.C. into this age-friendly city. And so in order to do that, we want to make sure that we help seniors to improve their quality of life. And so from a food perspective, or the lack thereof, why is it so important for our seniors to have fresh produce and the like, so that they can enhance their life? Why is it so important?
Well, I guess we can go right into health. We know that seniors who are facing the threat of hunger are 50%, sorry, I don't have these numbers committed to memory, but they're 50% more likely to be diabetic, and we know that's a big problem in the district. They're 3 times more likely to suffer from depression. We know from the research they're 60% more likely to have congestive heart failure or experience a heart attack, and we can go on and on. So if you are food insecure or at risk of hunger, however you want to say it, if you're a person, if you're a senior in this city and you're not getting the nutrition you need, there are dire consequences. That's, I mean, and I want to congratulate you. I know recently you added salad bars to the wellness centers. That's really important. That's not a small deal. That's not happening all over the country. So congratulations on that. I think that's a huge step forward.
Thank you so much. Ms. Reichel.
Yeah, and I'd like to add to that we at the food bank administer the Commodity Supplemental Food Program, which provides about a 30-pound bag of healthy supplemental groceries to needy seniors every month. And in addition to providing them with, basic elementary foodstuffs that are specifically formulated for their dietary needs, this food package encourages them to cook. It keeps their minds active, it gives them something to do, and I think that's another way food can help seniors with their longevity and their well-being.
Can you tell our viewers out there what is included in those food packets?
Sure. So I like to say that, like the school lunch program, which with people might be more familiar, the Senior Commodity Supplemental Food Program has some sort of basic staple elements. So typically in a food package, you'll have some sort of type of milk, you'll have cheese, you'll have healthy grains, you'll have cereal, you'll have low sodium canned vegetables, low sugar canned fruit, and different types of protein like peanut butter and also canned meat. So really a lot of different components that can help constitute many different meals. In addition to that, at 2 of our clinic sites, which are open in Wards 7 and 8, we're offering fresh produce. So that's something we're looking to do, as well as expand fresh produce access for seniors who are participating in the program.
Great, thank you so much. Ms. Benvey, I want to switch gears here and really focus on strategy for seniors. And you're a policy expert, and you're very familiar with the Supplemental Nutrition Assistance Program, as you mentioned a moment ago. So how can seniors, and I remember doing the SNAP Challenge, I think it was last year, it was my wife, Christina, and my, at that time, 5-year-old daughter, Chloe, who took advantage of the SNAP Challenge. And I was like, wow, really didn't get a chance to take advantage of the fresh produce on that tight budget. It was really eating a lot of pasta, a lot of rice. Not that I don't love it, and that's why I look the way I look. But how do we get beyond eating the unhealthy lifestyle? So from your perspective, how do we help? The question is, how do we help seniors to stretch their budget on that fixed income, and you have only limited dollars on the SNAP program? How do we help them to stretch their budget?
Well, I think it's a huge challenge in a place like DC where there are high costs of living here. So I would just highlight taking full advantage of all the nutrition programs that are available, like SNAP food stamps, the commodities program that Paula was talking about, and the wealth of other senior nutrition programs. DC has done a great job of really promoting farmers markets. You mentioned promoting healthy eating and access to fruits and vegetables. And we know that so often, unfortunately, the produce is what is very expensive and difficult for seniors to get. DC has invested in some farmers market nutrition incentive programs to make access to produce more affordable for seniors and others who are low income. So that's a huge piece in stretching low-income seniors' food budgets.
When is the next SNAP Food Challenge?
So DC Hunger Solutions, along with our sister organizations, Maryland and Virginia Hunger Solutions, are launching what we call the SNAP Challenge, October 6th through 12th. We're encouraging government officials and residents of DC to join us. Essentially, we ask people to mirror living on a food stamp or SNAP diet for a week. And so that means you get $33 to spend on food for 7 days. And we find that while this experience, of course, cannot fully give people the experience of what it is like to live on SNAP day in and day out, it can be hugely influential in showing people just the many challenges that people who are living just on SNAP face.
Now, how does one enroll into this SNAP Challenge?
We have a registration page on our website. So if you go to our DC Hunger Solutions website, which is www.dchunger.org, there is a link to our SNAP Challenge registration page, and I encourage everyone to sign up for it.
Thank you, Ms. Benvey.
Thank you.
When we come back, we will have more on senior hunger.
For those dealing with the struggles of caring for a loved one, we hear you. Visit aarp.org/caregiving for advice and support.
The Health Spa, Thursdays 7 to 11 p.m.
Welcome back. So we're going to get into a further discussion on ending senior hunger here in Washington, D.C. And just want to ask our panelists today, our next question: how does your organization address senior hunger? Matt, let's start with you.
Thanks. We're a national organization. We obviously, as I mentioned, we do research about senior hunger, and we do it nationally and locally in the district. We look at the numbers in other states. But it's important to not just do research. You then have to take what you learn and innovate programs. And as you know, we came to you about 6 months ago with an idea, and we knew from our research that here's the rates of senior hunger, and we know that anecdotally we knew there was a lot of food waste in senior feeding, in the senior nutrition world. And we wanted to look at, for the first time, measuring, quantifying that waste. How can we reduce food waste in your wellness centers? How can we reduce waste? How can we learn about what the waste is telling us? Even plate waste, the seniors are wasting food. Why? Do they not like something? Is something not meeting their needs? Are they not drinking milk because they're lactose intolerant? The waste on their plates can tell us a lot, and it can help you better serve their nutritional needs. The second part of the project, instead of throwing away the food waste, we can compost it. So it now becomes a really good sustainability project for the district. Instead of sending food to landfill where it creates methane gas and it's terrible for the environment, we're going to compost all of the food waste in the wellness centers and the pilot sites that we're working with you on. And then the third part, and this is where it closes the loop on the project, is the compost, it's great that we're composting the waste, but what do you get in return? You get nutrient-rich soil. That's what food waste turns into, nutrient-rich soil. And then we have a chance to work with the seniors, to get them involved, to give them growing and cooking and nutrition education to grow healthy fruits and vegetables in soil that came from their food waste. So it introduces a whole new source of healthful food, and it really gets them involved. So waste reduction to make your program more sustainable, to do more of the great work you're doing, but then help the DC environment and engage the seniors. So it's sort of a win all the way around, and we're thankful to you for having the leadership to say, you know, we've been doing something a certain way for a long time. Let's try something. Let's try this. Let's innovate and see what difference we can make.
Perfect. Thank you so much, Mr. Levine. Ms. Riker, what is the Capital Area Food Bank doing to end senior hunger?
Well, thank you, Dr. Thompson. I know I mentioned the Commodity Supplemental
Yes.
Food Program, which we're the lead agency for the DC Office on Aging, as well as the Senior Farmers Market Nutrition Program that Catherine touched on, which is run in tandem with the Commodity Program. So we're very pleased to be the administrator of that program. But I do want to highlight that the Capital Area Food Bank is the largest emergency food provider in the DC region. So annually we put out about 42 million pounds of emergency food into the community. That's about 35 million additional meals. And that's going to 500,000 people in the region. Now we're a nonprofit, so you know we do keep track of who it goes to, but we know we're touching seniors on many different points. We're touching them at our nearly 500 partner agencies throughout the regions. Those are smaller nonprofits, church pantries. We know seniors are going to those pantries as well as to our direct services. So we really try to be everywhere that seniors are and to make food access as easy for them as possible.
Awesome. Thank you so much. Ms. Benvey.
Sure. I think we're doing a number of different things on different levels to address senior hunger. One main thing that a lot of my work focuses on is speaking directly with seniors about the issues that they're facing and talking with them. My staff and I go out to the senior wellness centers across the city and talk to seniors about programs like food stamps. We also regularly hold trainings for social workers, nutritionists, and other staff at organizations that serve seniors, so they're aware of programs like food stamps, the commodities program, and other nutrition programs that seniors can benefit from and may not necessarily be aware of or be aware that they qualify for them. And another really important part of our work at DC Hunger Solutions is finding policy solutions to hunger. I think a good example of that work is last year, the last policy cycle, we were able to work with community organizations and the local government to pass legislation that will increase the minimum food stamp amount. So once that policy is implemented, no one in DC will get less than $30 a month in food stamps, which is an innovative policy approach that no other state is really doing at this point.
Absolutely. Have you received feedback from the community about this increase? What is their take
So
on it?
the increase has not yet gone into effect. During this next fiscal year, it will go into effect. But something I'd like to highlight is the idea for this really came from the community. So much of our work is speaking with seniors who are dealing with poverty and hunger issues. And we heard from so many people that the minimum benefit of $15 just was not enough. And if you doubled that, $30 a month could actually make a difference in providing access to healthier food and adequate food. So the idea really came from seniors themselves, and I would welcome suggestions from the senior community and others who serve them on other policy ideas that we could advocate for.
Thank you so much. A follow-up question. How can seniors enroll into the SNAP program? Can you tell our viewers out there?
Sure. Well, DC has passed a couple of laws recently that actually make the program a bit more accessible for seniors. To apply for food stamps, there are a number of different documentation that you need to bring. You need to be a DC resident. You need to show proof of your housing expenses. Seniors can show proof of their medical expenses, which if they can show that proof, they can potentially get a higher food stamp amount. The DC office that administers the food stamp program is the DC Department of Human Services. They also allow for phone interviews, so seniors can send in their paperwork to an application to apply for the program and complete the interview over the phone, which reduces some of the transportation issues that seniors face.
How long does it take? So from the time a senior submits that completed application, how long will it take for them to get the benefits?
So according to federal regulation, states have 30 days to make a decision once an application has been submitted. So after 30 days, the senior should know whether or not they've been approved.
Awesome, awesome, great, thank you so much. You are doing excellent work, and I know our viewers hear it loud and clear of what you guys are doing in the District of Columbia, and I want to again commend you all for your work. But we have others. We have folks who want to volunteer, who want to help out the vulnerable population and just have time in their hands. So what can we do, and starting with you, Mr. Levine, what can we do to just increase the efforts in the community, getting folks involved? How do we help folks in the community who want to be involved with civic engagement? How can we get them involved with what we're doing here?
Well, I think something as simple as, and I don't remember who mentioned it, something as simple as word of mouth. So if you know your neighbor is potentially in need of services, or even just in need to go out and socialize, if you're going to the Senior Wellness Center or the Senior Center, bring them.
Yes.
With all the wonderful things that are available to these seniors, I mean, the more seniors who are accessing them, the better. I mean, I'm working with you on how we can afford all the seniors. But if you have 104,000 seniors and all of them are taking advantage of what's available to them, we don't have to have this conversation.
Yes.
So I think word of mouth is huge. It really is. And then once you get to the Wellness Center, you can do growing and you can be involved as a senior, and you can really do some good in the community. I know there is volunteering going on from these centers, but use what's available to you and bring someone with you if necessary, or if somebody needs help, tell someone who can provide them help.
Yes. Thank you so much. That's right.
And I'll echo what Matthew said. I think you know, there are many ways that folks can contribute and to help on this issue. Certainly, as a volunteer supported organization, I would thoroughly encourage people to look into volunteering at the food bank. We pack all of the bags that go out to seniors, the commodity bags, at the food bank, and they're all packed by volunteers. And so that's something that we do continually. We have 18,000 volunteers a year. So obviously I would love for them to come to the food bank, but there are other ways to engage. Always encourage people to use their skills. What are they good at? Are you a good speaker? Go and advocate for senior hunger. Are you a videographer? Go make a video of a senior. Do what works with you, for you.
I like those ideas. Now, if someone is interested in volunteering at the food bank, what should they do? Is there a number you can give our viewers?
Sure. Our number is 202-644-9800. So you can call there and they'll refer you to the volunteer department. You can also check on our website, capitalareafoodbank.org.
Thank you so much. Ms. Benview, what is your take on helping more folks to get involved with ending senior hunger in the district? How can they volunteer?
Yeah, I think there are a number of different ways that people can help end this problem. One, I would definitely encourage everyone to reach out within their own communities and networks to help spread the word about these nutrition programs. So often I think people don't realize that they might be eligible for them, or perhaps haven't heard of them all. So helping spread the word about these programs is a great way to go about that. We have one huge volunteer event every year during tax season. We partner with the DC Earned Income Tax Credit Campaign. And this past tax season, we deployed about 45 volunteers at free tax preparation sites around the city to do food stamp outreach. The idea being that there are many people who are working full-time yet still might qualify for food stamps. And actually this past year we found a number of seniors who were working, going to these free tax preparation sites. And a lot of our volunteers went out and helped spread the word about food stamps, handed out flyers, and actually helped people fill out applications for the program.
So based on your statistics, how many seniors are not taking advantage? So based on those who qualify but they're not taking advantage of food stamps, any data that you can share with the viewers?
It's hard to know exactly how many seniors there are out there who are not taking advantage, but we do know that seniors are one of the most underrepresented groups in the overall food stamp population. There are many more seniors who qualify for the program than who actually participate in it.
Great, thank you. Well, I want to thank you all so much for being here today and sharing your insight with the viewers today. And so just a recap on what you all discussed. Communication is very huge. And so we understand that word of mouth, we have to get the word out. So going to our churches, we can do it. We're the nucleus. We go to our churches, we go to synagogues and mosques and the like. But it's really going to take our seniors who are taking advantage of the resources and making sure that they're passing that information along. And Matt, I love the idea of if you're going to the wellness center, you're a senior, you're going to the senior wellness center, bring a friend along, bring another senior along. So it's very critical. And this is going, I truly believe this is our opportunity to combat senior hunger. We have to be able to get into the homes of those seniors who are socially isolated, who've outlived so many family members in the area, or who have family members in other parts of the country or other parts of the world. It is our opportunity to step up to the plate, to really engage these individuals, these vulnerable seniors, to make sure that they get the necessary resources. We don't want to see anybody going hungry in the nation's capital. It is up to us to figure it out, and I know that we can. We have, because of your advocacy, your organization's advocacy, we have increased the budget. We have increased the budget at the Office on Aging. So we have more senior programming when it comes to nutrition programming at the congregate meal sites. In fact, October 1, we'll be serving seniors a hot meal 6 days a week at the 6 senior wellness centers. So that's huge. And you mentioned about our salad bar. I'm so excited about the fresh fruit and salad bar. We have an opportunity for many more seniors to take advantage of the commodity supplemental food program offered by the Capital Area Food Bank. We want to thank you all for that partnership. And of course, the SNAP Challenge. And so we want more seniors to take advantage of the Supplemental Nutrition Assistance Program and to be able to stretch your dollars as far as possible. And if we can do this, we know that we can begin the process of ending senior hunger in Washington, D.C. And I want to thank everyone today for viewing this show, and I hope that you learned something about senior hunger. Again, I want to thank our panelists here with me, my excellent colleagues who are very committed to ending senior hunger. And to our viewers out there, please join us, join the D.C. Office on Aging and our partners so that we can end senior hunger. If you want more information about the different nutrition programs offered through the Office on Aging, please contact us at www.dcoa.dc.gov. Thank you very much.